Is 24 minutes after 7 o'clock. Former President Jimmy Carter announcing it at age 90. He is going to be battling cancer. He says he's ready for that fight even at that age. Dr. Keith Argenbright, Medical Director of the Moncrief Cancer Institute in Fort Worth. Thanks for your time this morning. I guess we don't know at this point how developed that cancer is and where it has spread to his body. We do know it's gone beyond the liver where it was found.
Good morning, Tim. Thanks for having me. And yes, we do know not a whole lot. The family hasn't released all the details yet, but they have released enough details for us to know that the liver is involved and that it has spread, which means that it is now metastatic. And that's cancer's never good, and metastatic cancer is certainly not good.
Metastatic means it spread to other organs beyond where it was found, of course. The first question for doctors as they look at that is this treatable or not? And if it is, how aggressive are you in somebody who's 90 years old?
Well, great question. Certainly, President Carter certainly doesn't act 90 years old. He acts much younger than that. But again, the reality is that more than likely this is an aggressive cancer because it has a spread beyond the original site of the liver. Certainly, as physicians, we have lots of different things to offer a patient like this. We can oftentimes offer chemotherapy, we can offer surgery, we can offer radiation, and a lot of it really just depends on the actual clinical presentation of the case and how large the tumor is, how far it's spread, and all of the things that I mentioned, the chemotherapy, the surgery, the radiation, those are not without side effects. And so now you begin to weigh the pros and cons of each. And I think at the end of the day, what you want to try to offer the patient is the best quality of life that they have in the time remaining so that the president can have quality time with his family in the time that he does have remaining.
Is it your job to give them hope or to be blunt and realistic about what the diagnosis is?
Well, I think it's both. You always want to tell the patient and the family exactly what the facts are, and you want to lay it out there, and you want to give them all of their options. But I learned a long time ago, you never take away hope. Hope is something that we all have. It's something that we all need, and it's extremely important. I think, as I said before, I think the quality of life and the way that he spends the rest of the time that he has with us is probably the most important thing.
Dr. Keith Argenbright with the Moncrief Cancer Institute. Thanks so much for your time this morning.
Tim, thank you. We're glad